Thank you again for your invitation, and it's a pleasure to be here to express my solidarity with you, to speak with such uh, um, excellent guests, and for many frontline NHS workers who I want to pay tribute to as well. And there are many on the panel who I follow closely and listen to carefully. And apologies if Sonia and David and others, if I sometimes even steal your lines because they're so good. I don't know if you noticed, David. I saw you tweet about being at your wit's end about the flu vaccine shortages over the weekend, and I actually ended up saying that I said GPs were at wit's end, and that got covered by the BBC. So that was all down because I saw your tweet, David. So apologies for plagiarising you. I hope you don't mind. But there's a lot going on, and there'll be a lot of detail in the presentations. But I just want to reassure you that first of all, we did vote against this at second reading, and the bill started in committee yesterday. And we are putting forward, and the amendments should have gone down today, I believe, in Justin Madder's name, who's my colleague who is on the bill committee, amendments to try and take the virgin cares off the world off the integrated care boards. We should be putting down amendments to make it clear that, as David says, that the NHS should be the default provider. We are making it clear that the Secretary of State's duties and responsibilities to provide and make arrangements for care as it used to be defined in the previous healthcare acts should be reinstated, and we are putting down amendments around safe staffing and workforce. I mean, a whole host of amendments, but I know these are some of the amendments which I know campaigners are particularly interested in, and that bill committee will go on until November, and then we'll vote again in the House of Commons, and it goes back to the House of Lords. And just from a campaigning point of view, a tactical point of view, look, we will make the argument with passion. We'll do our best to persuade other members of Parliament. I have no doubt we will win the argument, but I'm also of no doubt we won't win the votes in the House of Commons. But that doesn't mean we shouldn't try. When it goes to the House of Lords, it is a horse of a different colour. The Tories broadly will probably still win most votes, but not necessarily, because it's a different arithmetic in the House of Lords. So it's really important that we push these arguments now around and why we're opposed to virgin care being on the board, and why we are worried about. We've never wanted the Lansley procurement competitive tendering rules, but given what we've seen in the COVID pandemic, the idea that the Secretary of State should just be allowed to hand out contracts willy-nilly with no procurement framework whatsoever is utterly anathema, because we've seen what that means with Tory ministers handing out contracts to their mates and Tory donors, often getting duffed PPE in return, or failing contact tracing systems. We also think, actually, and although we're focused primarily on clinical and public health services here, I also think we should try and use the bill to put down some amendments to bring other services in-house. I think that some of the ways in which cleaning and etc. has been outsourced over the years has been quite scandalous. So these are the sorts of points we're going to be trying to make, and we need your help and research and advice, as always, on how we make them. I know it has been difficult, and I'm well aware we need to mobilise. The party needs to mobilise better and get out there in a more forthright way on this, in which we will do. Because what you are seeing, and this ties it to what we've seen in the last few days, you can see what the Tory agenda is. The waiting lists now are at record levels, and this bill doesn't do anything to reduce waiting lists. In fact, there are even some Tory think tanks saying the bill's a complete distraction when we need frontline clinicians focused on the waiting list. So why on earth are you reorganising the NHS? So there's even Tory sort of think tanks saying that. The Centre for Policy Studies said that at the weekend. And the Policy Exchange think tank have said that, or something similar to that as well. But the waiting lists are now so severe, are so high, at record highs, with 300,000 people waiting beyond 12 months for treatment, that you are seeing an absolute boon, an absolute bonanza in people turning to the private sector because they cannot simply bear waiting longer in the pain and the agony and the distress, waiting longer for a hip or a knee replacement or cataract or a hernia operation. They are taking out these self-pay options with the private sector. And if you look at the private sector websites and you look at the private sector specialists, they're all predicting that this is going to be a really, really attractive time for the private sector because so many people are going to turn to the private sector. And it's now, and we're not talking here about sort of, the wealthy and the rich. We've got people, working people, who are taking out loans, getting into debt. We've got people remortgaging their house because they want a hip replacement or a knee replacement or a hernia operation. And the reason why that is so devastating is because obviously, health is a human right. You shouldn't have to put, you should get healthcare regardless of your wealth. So it's immoral. But we're essentially seeing a two-tier health system opening up in front of our eyes, eroding the very principle of a universal healthcare system. And the whole point of a universal healthcare system, and if we all go back and read what Bevan said, he wanted a universal healthcare system that didn't divide people into the sheeps and goats, because he wanted everybody to have a stake in that healthcare system, and he believed that would be the most sustainable and equitable and fairest way to deliver healthcare, and he was right. And yet, if you have a two-tier system opening up, you will have, over time, pressure from the right, pressure from the Tories, to move away from a universal system and move to a system based on private health insurance. And that's why this is the second point I want to make, and this hasn't been picked up so far in the debate. We've just voted against a national insurance rise here in the House of Commons because we don't think it's fair to ask care workers and nurses and midwives to pay more when they've had so many years of pay restraint. We don't think it's fair to ask them to pay more when they're not getting anything in return, particularly if you're a care worker. You're effectively being asked to pay more in tax, and you're not even getting any pay rise at all, as far as we can tell from what's been announced. But I think there's an even more fundamental thing here. And some of us who think, some of us on the sort of the left or amongst progressive campaigners sometimes think, well, yeah, hypothecated tax, why don't you have a health tax? Then that will command support, right? It's a dangerous road to go down. It is a slippery slope, and let me tell you why. I think, maybe not today, maybe not tomorrow, 2, 3 years, 4 years down the line, we will see Tory MPs and Tory think tanks saying, we have a hypothecated healthcare levy now, paid for by national insurance. Why not allow those people to take that national insurance contribution and put it into workplace insurance schemes and private health insurance schemes? I bet you we will see this. As I say, maybe not today, maybe not tomorrow, but that is the fear. In a few years' time, you'll see the Tory right pushing for that. It's why healthcare should be funded through taxation in a progressive way, and we should have a universal system. So we are campaigning on this. We're continuing to campaign on this. We'll be voting against. We'll be trying to get our amendments passed in committee, and then we'll be. I suspect they won't go through, and then we'll be voting against this at the different stages in Parliament. And we need to warn people what is going on here. The combination of putting the Virgin Cares, etc., on the local boards, designing and delivering your local healthcare permission, and a two-tier system opening up where people are encouraged to go private for their elective surgery really does mean this is a moment of great peril. I appreciate these things are sometimes complicated to get over because they are sometimes complicated messages, but I'll give you my pledge that we are determined to make this argument, but I understand we need to make it with more force, and that is something we're going to be doing.